Pyari Sath Sangat Jiyo, Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. So ਅੱਜ ਸਵੇਰੇ ਅਸੀਂ ਰਿਕਾਰਡਿੰਗ ਇੱਕ ਕੀਤੀ ਹੈ ਜਿਹੜੀ ਸਾਰੀ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ ਸੀ ਤੇ ਉਹ ਸੈਨੋਜ਼ ਦੇ ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਦੀ ਫੇਸਬੁੱਕ ਪੇਜ ਦੇ ਉੱਤੇ ਹੈਗੀ ਹੈ ਤੇ ਹੁਣ ਉਹਨਾਂ ਰਿਕੁਐਸਟ ਕੀਤੀ ਵੀ ਇੱਕ ਰਿਕਾਰਡਿੰਗ ਇੰਗਲਿਸ਼ ਦੇ ਵਿੱਚ so ਇਸ ਕਰਕੇ I'm going to record this one in English but the Punjabi version is available that was recorded this morning at the Facebook for the Senoze Gurdwara. So today I'm going to talk about the coronavirus. So I'm just going to starting up my computer. So first thing I just want to reassure most of us, because hearing about the death from the coronavirus in Washington State, everybody is panicking about coronavirus. But I can tell there are so far only 71 cases in the whole US and only one death. So if we compare the coronavirus with the flu virus, which has affected, even in this season, flu season, 32 million people have been affected by flu, as compared to just 71 people from the coronavirus. But as we know, anything that's new to us, we always panic because we don't know. This is the first time this virus came. In the past, if you remember, in 2002, there was another virus called SARS, so which also came like similar to this one. And at that time was also a lot of panic and a lot of anxiety with that. But I think we can take some very easy measures to prevent spread to other people. So that's why I want to talk a little bit about that, as well as give you a little background on what coronavirus is. So coronavirus means, corona means it's a crown. So basically when you look at the structure of the virus, it's shaped like a crown. So that's what coronavirus, so that's where it comes from. So where did it originate? So actually it's all the initial cases, everything started, there's a Wuhan province in China, that's where it started from. And what was the origin? So we're still trying to figure out what the origin, so it looks like it's more like animal source, and then it spread to the humans, and then human to human. So that's why everything was new, and that's why they could not figure out initially what was going on. And that's why in China there was like a lot of deaths initially. But I think at the time, I think we are learning more about it. So I think we will be able to tackle much better now. So if you look at, so far it has spread to 33 countries. So there have been new cases. It started in China, then Japan, South Korea, Iran, Italy. So those are the big ones, the 5. But then we have spreading cases other countries too, including India, US, Netherlands, and a lot of other countries where like not that many cases as compared to China. And if you look at for the Center of Disease Control, so which gives us the guidelines what precaution we should take, and they said that they are, basically they said it's a low risk, so it's not a high risk. So that's why I think we have to take precautions to make sure that it's it's not spreading, so if with simple measures. And if you look at coronavirus versus flu, lot more people die from flu. So far in this season up to now, 18,000 people have died from flu. We don't even think like these many people can die, but 18,000 people have died from flu in this season, which starts in late November till now. Today is March 1st. So if you look at November, December, January, February, 18,000, that's a big number. And so if you look at coronavirus, because it's something new, we don't have vaccine, but against flu we have vaccine. So that's why I just want to take this opportunity also to tell everybody it's good idea to take a flu shot, because simple flu shot, you can save lives, especially if you are younger or if you are older than 65. I think that's those are the bigger ones. It can prevent people from dying if you take flu shot. Because what happens is when the flu is not controlled, it becomes pneumonia, and that's how it causes organ failure and people die from flu. So other than that, if you look at other things, so how do we differentiate? Because that was a big confusion. If somebody has a flu or they have a coronavirus, how can we differentiate between them? So if you look at typically with the flu, you will have some symptoms are common to both. If you look at the slides, you'll see fever, cough, both. If somebody has a coronavirus or somebody has a flu, both have the same symptom. But the differentiating point is with the flu, you will also have a lot of body aches. You will have running nose, you will have chills. And rarely you will have shortness of breath, difficulty breathing. But with the coronavirus, actually it affects you. If you look at above, so this is called lower respiratory, anything below the neck, which is your lungs, your lung tubes. So basically the coronavirus actually affects, it can affect the upper tube, but also why it's so deadly is because it affects the lower, which is your lungs, it causes pneumonia, and then multi-organ failure, and that's how people die. If you look at head-to-head, flu versus corona. So with the flu, if 1,000 people get flu, out of that only one person dies. With the coronavirus, 2 people die every 100, not 1,000. So it's 2% mortality, which is very high. And that's why it's a little bit scary, but if we follow certain things, I think we can do a lot. So coming to how does it spread? Coronavirus, how does it spread? So there are 2 ways it spreads. And it's a little hard because with flu, if somebody has a flu and we come in contact, within 2 days to 3 days, we will have the symptoms. So it's very clear cut. With the coronavirus, it can take up to 14 days. So you were exposed, you would not have any symptoms for up to 2 weeks, and then you get sick. So that's why the predictability when you are exposed and then you have symptoms, there's a long period between them, and that's why it's a little bit more dangerous. And the second differentiating point is when you have a flu and when you sneeze and cough, the flu virus comes out to your sneeze or to your cough, it lasts only for a very short period of time outside. But the coronavirus can last for 9 days even outside. So it's a very, very, very strong virus which does not die that quickly. So that's why we have to make sure that when we are sneezing, when you are coughing, cover your face, cover your mouth, cover your nose. So that is an easy way we can, and wash your hand as many times. If you come in contact with anybody, and with this right now, since there was a case in Santa Clara County just recently diagnosed, so we want to make sure that we come in contact, handshake. So try to avoid it. I know it may not seem courteous, but I would say it's, prevention is better than, getting the disease. So I would try to, and then use soap as many times, when you go to work, during your breaks, make sure wash your hand. You may come in contact with somebody who has it, but they don't have symptoms, so we would just want, but there's nothing, we don't need to panic. But I think we need to make sure that we are safe. So that's why washing your hand is one simple thing. You can gel your hand with sanitizer, so that will also help. And if you look at those 83,000 cases that have been detected, most of them are adults, so which is a good news for the children, because if you look at regular flu, it actually affects children and more adult above 60, 65. But this virus actually affects adults, and they could be in 30s, they could be in 40s, they could be in 50s. But for some reason, when children get it, either they don't have any symptom, or if they have symptoms, they have very, very mild symptoms. So which is a very good news, because from children to children, spread is very quick. From adult to adult, at least they can take precaution, and it's not as bad as in children. So other thing that I would recommend is also when you sneeze or cough and you don't use the napkin or don't sneeze in your elbow area to prevent spread. Other is if I sneeze and cough and it goes my hand and I touch anything, and the next person who comes in, either it's a doorknob, door handle, a glass, could be a table, could be a chair, other person comes in and they touch their nose, and so that's how it spreads. So make sure use Lysol to clean up any surfaces that you think somebody who had a cold came in contact with. I think that will also prevent the spread, so we can break the chain of spread of infection. So basically cover your mouth, cover your nose, or if you don't have anything with you, just sneeze in your elbow area, elbow crease. So that way it stays with you. And if you touch your nose or you touch, make sure you wash with, and soap works as good as sanitizer. You don't have to go, if you don't want to buy sanitizer, it's good to have it in your pocket, but soap works as, so make sure you wash your hand. So that is very, very important. So now, other thing that I want to, tell. So, very common question. I work for Kaiser. I got a lot of emails from the patient. Can we get the mask? Because there are different types of masks. So I just wanted. So one is a surgical mask, which is a regular mask that we wear. So can that prevent somebody from having infection? No, it cannot. Regular surgical mask. If you come in contact with somebody who has coronavirus, it will not prevent spread to you. It needs a special mask called N95. And even if you buy on Amazon the mask, it has to be fitted. You cannot just buy it and put on your face, because if there is any leakage on the sides, you can still get it. So that's why the mask is good for anybody who has symptoms, so to prevent spread to other people. But if you are asymptomatic, means you don't have any symptoms, it does not protect, So it's very, very important. If somebody has sneezing, coughing, fever, they should wear a mask. If they go outside, make sure they wear a mask. If there's cough, sneeze in the hand, make sure to wash with soap and water. But if somebody does not have symptoms, they don't need any mask. And that actually creates more panic and more anxiety, and we don't want to give more panic and more, because it's only 71 cases and only one death. But we don't want to let our guard down. We want to be safe. So that's why I say again and again, I'm saying wash your hands with soap. Use a hand sanitizer so that we can kill the virus. Okay? Now, other question that a lot of people are asking, is there a vaccine for coronavirus? So far we don't have vaccine, because vaccine development takes time. And before we can give vaccine or injection we have to test it on the animals and then on the humans to make sure they are safe. Because we don't want to cause more harm than the benefit. So that's why we want to make sure I think they already started working on developing the vaccine, but I don't think it will be available that quickly that we can give this, right now. And the other hope is that what they found in China is that this virus likes cold and moist environment. So we're hoping as the summer comes and the temperature increases, so we'll be able to, take care of the virus with the heat. It's going to kill it. But do we know next year we can have, another November, December time we can have it back? There's always a possibility. But we can try to be as safe as possible. And then other thing, if somebody starts having symptoms, there's no need to panic. Call your doctor, ask their advice what you should do in case if you have symptoms. But if you're having shortness of breath, any difficulty breathing, you need to call them ASAP and tell them these are the symptoms, what is the next step? Because the testing is not, for corona, is not freely available. So there is a limitation. So Department of Public Health, only that is the place where they do the testing, but they can do it in the hospital or clinic where they go. But it needs special precaution, because when you walk into any clinic, you can spread to other. So they will give you guidelines what to wear, mask, and then they need a special room where they're going to separate you out from everybody else till they test and confirm. And if anybody has traveled the last 2 weeks to those areas in China for their business thing, to Italy, the northern part where the cases have been, to South Korea, to other parts where, South Korea, Japan. So make sure if you come back and you have any symptoms, stay home for 14 days till, you're safe. So that I would say very, very important. We don't want to spread it to, and other thing is not everybody will have symptoms. So that's why we need more testing, but testing, I think the CDC and they are trying to get more kits so we can test more people, but right now there's a shortage. So, but if you have some symptoms which are concerning, call your doctor. Don't wait. So that's very, very important, okay? And then I already recorded the same thing in Punjabi in the morning at the Gurdwara, Sanad Gurdwara website on the Facebook. And if anybody didn't understand the English, or they can go to the Sanad Gurdwara website and on the Facebook, and they can see that there. Thank you. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.